The tale you are about to hear is not one of my own design. My mind lacks the perverse twist that could conceive of the eldritch oddities that are presented in these records before me. But I must look past my doubts surrounding these second-hand sources. I am merely presenting my findings in the state I have found them, to be recorded for later scrutiny at my leisure. Perhaps, at the end of this, I may finally put this mystery to rest. My name is I am a private detective hired by Ashtree Asylum to investigate the disappearance of Dr Estelle Sharpe. She has been missing for several weeks now, and through my diligent frustrations I have followed her footsteps and discovered illicit encounters, a manor in ruins, and a terrible foreboding that I cannot shake. Sleep continues to elude me, as I cannot shake this feeling that these papers before me hold clues concerning matters that I, a mortal man, cannot comprehend. Regardless, I will do my utmost to articulate my findings. We begin with a leather medical journal, written in her own hand. It is well worn from frequent use, but the entry I wish to draw attention to regards the arrival of patient 0981 on the morning of the 31st of October, 1902.
Patient 0981, I ask that you stop screaming. You are beginning to upset the other inmates. Good. I assure you, you are in safe hands. You are alive, and we are here to help you. You don't feel safe. That feeling is understandable, given what you survived, but I am greatly relieved that you are able to speak. I was concerned that you would be catatonic for months. Speak slowly, and don't strain yourself. Who am I? My name is Dr. Estelle Sharpe. I'm here to ask you some simple questions to assess your mental state and determine the best course of action for your treatment during your stay with us. Yes, I am a fully qualified doctor of psychology and one of the most senior members of staff of this institution. I'm here to ensure you receive the best medical and psychological treatment available to us. Orderly, could you bring that chair in here? Then leave us be. Our sessions must be conducted in complete privacy. No, you don't need to concern yourself. They are fully restrained to the bed and are incapable of causing physical harm. I will ask for your assistance if needed. Now then, I am sure you have questions. Since you seem to be of some degree of intelligence, let's keep things fair between us. You ask me a question, I'll ask you one. Go ahead. Where are you? You are in the safe hands of Ashtree Asylum, to the north of Port Ashworth, on the English coast. Do you know what year it is? No? Interesting. So, what's your next question? How did you end up here? One of the fishermen in the harbour found you out at sea. You were clinging to the remains of a mast, seemingly the lone survivor of some kind of shipwreck. You were barely conscious, but in your brief moments of clarity, you screamed and thrashed like some beast from the depths. Eventually, you passed out from dehydration, and the police brought you here. We nursed you back to health and gave you this comfortable, padded room. You're welcome. Do you know your name? No. I can see that furrowed brow. Are you displeased with me as your doctor? No? Well then, ask your next question. When can you leave? Well, that depends on you, patient 0981. Are you going to be cooperative with me and the other doctors? Will you take your prescribed treatments and medications? Will you be honest with me and tell me everything you remember regarding your experience out at sea? Very good. Thank you for your cooperation. Now then, I ask that you do not move. There was one mark in particular I wish to examine closer and ask you about now that you're awake. Please try to relax. This won't be but a moment. Thank you. I'm going to slightly move the neckline of your shirt so that I may examine your neck and collarbone. Tell me if you feel any pain or discomfort. Most strange. This mark, just above the hollow of your clavicle, hasn't changed since your arrival here. Your other bruises, cuts and sunburns have healed nicely, but this oddity hasn't changed. Is this a birthmark? Not one that you know of? Describe it to you? Very well. It's about the size of a gold sovereign coin, almost perfectly circular, but a fluctuating shade of purple, sometimes closer to blue, sometimes redder, almost like a never-shifting blot of watercolor paint. I am normally tasked with handing the care of patients over to other doctors and orderlies here at the asylum, but as this is an especially intriguing case, and a matter of mind over physical ailment, I will be your personal doctor. I hope you approve of this. Good. Other patients have been resistant to the idea of a female doctor in charge of their care, but I promise that I will do my utmost to assist you in recovering your lost memories and helping you remember why you were out at sea in the first place. I also will ask for your consent should I wish to publish my findings. Your particular case may result in some interesting papers. Thank you. Now then, as for your treatment, we will conduct our sessions in the morning when you awaken. While you have been in a catatonic state, you have only slept when your physical body reached a level of exhaustion that you passed out into unconsciousness. I will be prescribing you medication to assist you in getting regular rest and easing your body into normal routine again. Now, this will take time, but we must be able to ensure that you are no longer a danger to others, as well as yourself. What do I mean by no longer? I ask that you remain calm and clear of mind when I answer your question. When you came to consciousness on the boat, you lashed out at the man who saved you. According to the other witnesses, you tore out his eyes. He survived, mostly, and you were handed over to us. I know this is a lot of information to take in, but know that we have nothing but the best of intentions for you. I have to tend to my other patients, but I will be back tomorrow morning. Just rest and try to remember as much as you can. If you require my attention, call for one of the orderlies and they will find me. Well, patient 0981, I look forward to discovering what's lurking inside that head of yours. If you enjoyed this ASMR tale and want to become one of the incredibly kind souls featured here, then please consider supporting me on Patreon. To access my Discord server, attend my monthly live narrations, and enjoy other perks, click on the Patreon link below. Don't forget to check out my merch store on Fourth Wall to pick up some stickers or pins featuring your favorite characters, or a stylish shirt to show your support for the Seraph of Stories. You can also catch me live on Twitch every Monday, Wednesday, and Friday evening, so be sure to drop by sometime. Thank you. Don't forget to subscribe, and stay wicked and wonderful.